Hey guys, Don here. Welcome to the $1 Million Minute. We're going to go over kind of the things that help get to the $1 million mark and beyond. This is a patient. This is a day. It was a Thursday. I'm recording for 19 appointments. I had 1 hour of open patients, but they did fill up one of those. So that was a patient that was filled in. So there was 3 slots, and then it went down to 2. One thing I kind of had a neat thing. I heard about this new website. It's called FreePik, FreePik. When I'm doing my newsletter, sometimes I need some images, and it's a way you can do kind of copyright-free images for your newsletter. So if you need something, look at doing that. For the day, I think my MVP, or my most valuable patient here, was a patient that had orthotics. So I did X-rays. She was an 82-year-old female. Just had some like ankle movement problems and really bad midfoot arthritis. And I did a high contouring orthotic for her. But let's go into the day. First one was the EPAT follow-up. So this is going to be established patient visit. He had 3 EPATs to the second met head. He's feeling better. Doesn't think he needs any more. Because of that improvement, I'm going to do one last follow-up in 2 months. If he's feeling better, I asked him to cancel that appointment. Another patient, this is a 68-year-old, came in for concern of a sore on the bottom of the foot. He did not have a sore. He just had a really kind of a bad callus. I trimmed down the callus. He also had really dry skin, so I recommended Amerigel Blue. It's a product that we sell here. And he had nail fungus, so I did a nail sample. I'm going to see him in 3 weeks to go over that nail sample. This next patient, 71-year-old, was a nail sample. I reviewed it, and I put her on the Lamisil. So Lamisil, Shoe Zap, shoe spray, and things like that. They're going to come back in 3 months. Another patient came in for the Lamisil number 1 as well, so this would be a follow-up after the nail sample. Got the same thing as the one before. This is another patient. This is a 71-year-old new patient. He had plantar fasciitis, so we got my plantar fasciitis number 1 treatment, which would be night splint, morning stretch, foam rolling, X-ray, and all that other stuff. And he'll come in 3 weeks, and then we'll possibly do an ultrasound at that time. Next patient was she was a patient. She had a previous amputation due to her neuropathy on her 4th toe on the left, and now she had a blister on the big toe on the right, medial first met head. She's been starting to exercise at home, and that caused rubbing in the shoe, which caused blistering because she has the neuropathy. So I kind of treated that with some betadine and offloading it, and then she'll come back as needed if that doesn't get better. She already has a regular standing appointment in the office. Another patient came in. This is one that was added on. He had bilateral matrixectomy because of ingrown toenails, so he'll be coming back in 3 weeks. Another patient was an 82-year-old. This is the one I talked about with really bad midfoot arthritis, so I showed this on the X-ray, and I recommended orthotics to offload that area. There's another patient, 71-year-old female. She was here for a wart follow-up. I did another lesion destruction. So this was the first time I did cantharidin, second time I did salicylic acid because it looks like it was almost gone. She had also a very wide foot, and I recommended LEMS because she likes going barefoot at home, and I think the LEMS will give her kind of that barefoot feel that she feels comfortable with. Another patient was a 45-year-old patient that she came in for her plantar fasciitis, and she was getting better, but she had mostly it was due to soft tissue. So I recommended an orb ball, ORB. This is another ball. We sell foam rollers and an orb ball. And this orb ball, because she wanted something so she could travel with. So I did also a physical therapy prescription for this patient because really I think a lot of her issues were due to tightness. And then she's going to come back in after physical therapy. Another patient came in. This is a wife of a patient that I see. She had a really kind of severe club foot issue where she was previously fused subtalar joint and ankle joint, and on the left side, and she has an AFO on that side. She also has neuropathy, and she had like routine care. So I did the routine care. I gave her a gabapentin for the neuropathy, and then she's going to come back to see how the gabapentin is doing in 3 months. Last patient in the morning. This was a 76-year-old patient that had an ulcer, and I was concerned about this ulcer, so I recommended getting an ABI because I think it might be a circulatory issue that is not healing. Afternoon, 65-year-old female that's got EPAT number 2 and also had nail concerns, so I did a nail sample, and I recommended and prescribed a cyclopirox cream for tinea pedis. Another patient was a 91-year-old patient that came in for a nail sample follow-up. Now, I pretty much talked him out of the terbinafine. I think that 91's a little bit old, but he did have neuropathy, so I recommended gabapentin for him, just at nighttime to start. Another patient was a 67-year-old patient that had really big bunions, and he was told, this is funny, he was told that if he got a hoka shoe, it would make his bunion go away. So I had to tell him, unfortunately, no, hokas don't make bunions go away, but it was a good try. And I got x-rays and gave him shoe recommendations. I like to give ultras and topos. Also, patient came in for plantar fasciitis number 1, was better after the first course. She also had some bunions, and so I recommended correctos, so she purchased correctos. Another patient, a 34-year-old new patient, failed terbinafine by another doctor, or she had actually a bad reaction, couldn't take it, and so I gave her diflucan. I'll see her back in 6 months. And then another patient was a 50-year-old. He had a lot of pain to his peroneals. I did a cortisone last time, didn't get better, and so I ordered an MRI for him, and he did not want Shockwave, so maybe based on the MRI, I'll recommend Shockwave. And then another patient was a 41-year-old that came in, and she had really, really bad bilateral heel pain. So she had bilateral equinus, bilateral heel pain. I got an x-ray, and since she was so severe, I actually did ultrasounds, and I did ultrasound cortisone on the right side, because the right side was there's more effusion, thickness, and pain on the right than the left, so I compared the two. She also had equinus bilateral, so she did the Pelto special, which involves night splint bilaterally, foam rolling, and a morning stretch. And then she's going to come back in about 1 month to see how she's doing. And then finally, the last patient of the day was a EPAT follow-up. So, actually, EPAT number 2. She has Achilles pain, and we were talking, and I usually recommend 6 treatments. So she had 3 scheduled. She's going to schedule another 3. So other things that are going on, I did find a orthotic coach. So I found someone on Fiverr I'm going to try. So I figure, couple $100 is pretty cheap money to help to try to work on my goal of getting better and doing more orthotics. So I'm not exactly sure how it'll go, but I'll let you guys know how that goes. And we'll talk to you next day, tomorrow.